This video is about the impact of aging on your spine and how to protect it. As we get older, it is not unusual to wake up with a stiff back or feel a little bit more fragile, but aging does not have to mean constant back pain. In this video, I'm going to walk you through what actually happens to your spine as you age, how you can protect it, how you can stay active and feel strong for years to come. Hi, I'm Dr. Deeptee Jain, and I'm a board-certified orthopedic spine surgeon. I focus specifically on helping adults move better as they age. The spine is your body's central support column, and while it changes over time, there's a lot you can do to keep it healthy. So let's dive in. Let's start out by talking about what happens as your spine ages. Your spine essentially goes under the arthritis spectrum, and that is a normal part of aging. Everyone develops arthritis as they get older. So what does that picture look like? It involves discs that lose water and flatten over time, joints that stiffen and the cartilage wears down, and the spine, which is losing flexibility and shock absorption. These changes are normal, but they can contribute to some pain, stiffness, and reduced range of motion. Some of the most common spine conditions that we see with aging, again, are as a result of this arthritis spectrum. They include problems like degenerative disc disease, and that's what I was referencing, when the discs actually shrink and they lose their healthiness, they lose their nutrition status. Spinal stenosis, which is when the spinal column narrows as a result of overgrowth from the arthritis, and it pinches down on the nerves. Arthritis in the facet joints. The facet joints are just like joints in the shoulder or the hip or the knee where there's cartilage, and that cartilage can wear down over time, and that can cause pain. Finally, postural changes. We know that as we age, we tend to lean a little bit more forward. And sometimes if we lean too much forward, and again, that's not what we are choosing, that's how our bones become and our spine becomes over time, that can actually cause a lot of disability and a lot of back pain. But the good news is that these issues are usually manageable. So what are some things that we should pay attention to that actually could be concerning? Stiffness every morning that takes hours to go away, pain that radiates down the arms and legs, frequent falls or balance issues, or a noticeable loss of height or posture. If you're seeing these changes, it might be time to make a change in your lifestyle. Protecting your spine doesn't require a complete lifestyle overhaul, however. There are small shifts that can make a big difference. Keep moving. Even light walking keeps joints limber. I would highlight this as the most important thing for spine health. A body in motion stays in motion, and I'm an orthopedic surgeon. My job is to maintain and help my patients maintain mobility. Sit tall and avoid slumping, especially at your desk. Use proper lifting techniques, even for groceries, and that means bending with your knees and your hips as opposed to your low back. And stretch daily to stay flexible. Think of it like brushing your teeth. These are daily habits that should be done on a regular basis. Keep in mind that your spine also is made a lot of bone. And so keeping that bone is particularly important, and your bones need fuel to stay strong. So make sure you're getting enough calcium and vitamin D. Prioritize protein to maintain both the proteins that are necessary for bone, but also the muscle mass around it. And if you're older, especially if you're a woman and you're over the age of 50, talk to your doctor about a bone density test. Strong bones mean a stronger, more stable spine. So do you want to slow down the process of aging and the process of arthritis? I'll say this is one of the most common questions I get as a spine care provider. And we don't have a lot of evidence to support actually what reduces the progression of arthritis. But I will tell you, movement is your best medicine. Core exercises protect the spine from the inside out. The muscles around the spine are like dynamic stabilizers. Resistance training keeps the bones dense and the joints supported. And low impact workouts like swimming or yoga can reduce wear and tear while boosting flexibility. The goal isn't to be a bodybuilder after all of this, it's to move with ease and confidence. So don't wait until you're in constant pain. If your symptoms are lasting more than 6 weeks, or they're waking you up at night or affecting your daily activities, perhaps a spine specialist can help identify what's going on and give you a game plan to help you manage it or even reverse it. I will say, while the pictures and the actual development of arthritis might not be reversible, that doesn't mean that we can't reverse the pain associated with it. So let's recap. Aging changes the spine, but it doesn't have to break you down. Daily movement, posture, and good nutrition are key. And early action can help you stay strong, upright, and independent for years to come. So if you want your spine to age gracefully, hit like and subscribe. And if you've got a question about spine health as you age, drop it in the comments, and I'd love to hear how you're staying active.